My name is Mark McGlade, and this is my wife Vanessa, and we're owners and directors with Home Instead Senior Care, Exeter and East Devon. At Home Instead, we provide home care support for older people in their own homes. We provide companionship, home help, and personal care, and many of our clients have dementia. Vanessa and I are both dementia champions with the Alzheimer Society, and Vanessa is also City and Guilds accredited to provide training to our caregivers, and all of our caregivers undergo at least 18 hours of dementia training before they look after our clients in their own homes. These are some of the most frequently asked questions from our clients and their families regarding care for dementia. Vanessa, what is the difference between Alzheimer's and dementia?
Excellent question, and one that we get asked frequently, something that we cover extensively on our City and Guilds training. Right, the difference between Alzheimer's disease and dementia. If you think of dementia as an umbrella term for the over 120 different types of dementia, of which Alzheimer's is the most common. 60% of people have Alzheimer's disease. However, they may have vascular dementia, Lewy bodies dementia, or Korsakoff syndrome, and there are, as I say, over 120 different types of dementia. So, broadly speaking, it's an umbrella term.
And for those living with having memory problems or having been diagnosed with dementia, what does it feel like to have dementia?
What does it feel like to have dementia? Well, it's been likened to that feeling of when you go upstairs in your home or you go into a different room and you get there and you think, what did I come in here for? What am I doing in here? And you say to yourself, I came in here for a reason. I came in here for a reason, but you can't remember what the reason is. That's the feeling that somebody has when they have dementia. They have that frequently during the day. What we do know is that however somebody feels with dementia, there is generally no pain associated with their dementia. So despite that feeling of awful confusion, there is no pain.
So what should somebody do if they are experiencing memory difficulties or they have been diagnosed with dementia?
Well, for example, if somebody is experiencing memory problems, we have to have a look at the frequency with which they're experiencing those problems. We all have momentary lapses of memory. So, for example, forgetting a telephone number or getting to the grocery store and forgetting a couple of items on your list, that's perfectly normal. If you have memory loss which is affecting your day-to-day living, that's when it's pertinent to make an appointment to see your GP. That's the first port of call if you've got a concern over your memory. So go along to see your GP. He or she will rule out other medical conditions such as depression, such as thyroid problems. Medical drug interactions can all cause memory loss. So it's important that he or she can rule those in or out. If there is cause for concern, he or she will send you off to a large hospital where you will undergo a day of tests, and then you will either come out with or without a diagnosis, and then you're able to plan a way forward. What we do know is if somebody has dementia, the earlier their diagnosis is made, the better their outcomes in the longer term. They're able to start a drug routine if this is applicable for them. They're able to plan ahead and make the changes in their life which will have the most positive outcomes for them.
These are the three most frequently asked questions that we have on a daily basis about dementia. If you have any questions or comments, please leave it in the comment space below, and we'll get back to you.